All right, perfect. So my name is Chris Eastlack. I'm the Senior Director of Growth Initiatives here with Excelsior University. I'm joined this evening by one of our admissions representatives, Bethina Toussaint. She is on the call to help with any sort of questions from an admissions process and to chime in as needed with any sort of questions towards the end of the program. So I want to go ahead and let you know the first thing I want to call out is this information session is for individuals that are interested in learning about our Associates in Science and Health Sciences program. And our next start date for that particular program is going to be September 1st, and that is our fall one term. So again, the Associates in Science and Health Sciences is the program we're learning about tonight, and our next start date for that program is going to be September 1st. So what I'd like to do is start off by telling you all a little bit about Excelsior University, brief overview of our history, kind of give you an idea of the school that you'd be joining. I want to go over accreditation, which is super important. Then we're going to dive into the actual program. Want to go over finances. If you like everything you hear up to that point, we'll talk about what the admissions process looks like and what next steps would be. And then lastly, we're going to go over any questions you have. I will say questions from a generic sense, maybe a high level sense, not real detailed and specific to you. Our admissions team will follow up with the individuals that are attending this evening, and that's where you can get into the more specific questions about your situation. You know, you're wondering about that one course that you took at another community college, whether it'll apply to the program. That's when we'll get into those more detailed personal questions. For the purpose of tonight, it would be high-level questions that have to do with your with the program or understanding more about Excelsior. All right. So Excelsior was founded in 1971. It's a nonprofit institution. Initially, what Excelsior did was they awarded college credit for work that adult learners had already completed. This is the idea now that's like prior learning assessment or prior learning credit. That's kind of what they started out doing initially, was getting this credit for working adults, the work that they did outside of the classroom. As time went on, they developed their own courses, eventually their own programs. They became Excelsior College for many years. And then just about 3 years ago, we were able to become Excelsior University. We've now grown to 40 plus programs in 6 different areas of study. So liberal arts degrees, business, technology, health sciences, nursing, and public service. So again, you're going to find about this health sciences program tonight. Maybe it's not for you, but we do have 40 other programs that might interest you. And again, I'm sure you know someone that's probably thinking about going back to school. Chances are we have a degree program that they'd be interested into as well. So please let them know about us. This second bullet point here comes from our mission statement, and it's something that always jumped out at me, and I really love it. And that is that we meet students where they are both academically and geographically. And that's true. Our graduation was a few weeks ago, and it was an absolute awesome experience. But we always highlight how many graduates we have globally. And I think it was like 19 different countries were represented with graduates at that last ceremony. So again, you may be in the United States this evening, or you may be joining us from another country right now, finding out about this program, which is pretty cool. Fun fact, our youngest graduate was 9 years old. Our oldest graduate was 70. I think we have to update this. I'm pretty sure at the last graduation ceremony, there was an 82-year-old person that graduated. So our average age of our graduates is 35 years old. So just to understand, it is still an adult population, not necessarily that traditional right out of high school student, although we do have those. Obviously, we have students that are in high school earning their degrees with us, which is pretty cool as well. So again, just a high level of some information about Excelsior that you'll possibly be joining. The university is accredited. We are a member of the Middle States Commission on Higher Education. If you're not familiar, accreditations have a set of standards that schools have to meet in order to say they have a certain level of quality of education that they're providing to their students. If you're going to do any other research into other institutions or schools, please make sure that the school is accredited. It's very important when you go forward with getting a job or getting a promotion or going to sit for some sort of a licensure or an exam, a lot of times they're going to require that the degree requirement is from an accredited institution. So very important that you understand that and you do that research regardless of what school or institution you look at. Again, we are regionally accredited by um, the Middle States Commission on Higher Education. Okay. Down below here, you'll see these different symbols. They actually represent all of the different programmatic accreditations that we have. So our business programs, our nursing programs, our engineering programs, and then some of our cybersecurity programs are recognized by NSA and the Department of Homeland Security. So I put those on here as well. So again, just something that you want to research, make sure you understand and that you know about as you are doing your research. Okay, so why would somebody be looking into an associate's degree in health sciences? So we pulled this data from the Bureau of Labor Statistics, and right now the expected growth for health-related occupations is expected to grow tremendously between 2023 and 2033. They're expecting about 1.9 million openings per year on average in the healthcare sector. So there's obviously going to be a demand for folks that want to study in this area. The associate's degree, it is an entry-level degree. So these are going to be your entry-level, more basic positions. But these are some of the areas that you could look to go into. I'm not going to read all of them, but most of them are what we would call stepping stones, right? You're going to possibly begin working and most likely earn some additional certificate or some some level of a credential that's going to let you further your career. Maybe that's going back to school and getting your bachelor's degree. But yes, this is an associate's program, typically done a little bit quicker of a time frame and allow you to get working while continuing to pursue what other educational opportunities you might want to continue to further your career. But these would be some of the entry-level positions that you could expect to look into once you finish this degree. So our program is 100% online. So you're not going to have to be on at any given specific times. This is done on your own time. However, there are deadlines. So I always just like to make sure that you are going to be able to complete the coursework by the deadline. So, your first assignment might be due by midnight Thursday. Great. You don't have to get on there on Monday. But by Thursday, you're going to have to allot some of the time in your week to get that work done and have it submitted on time. So again, just want a high level example of how this would work and make sure you understand that. We have 3 semesters a year. They are 16 weeks in length. Within each 16-week semester, students complete 2 8-week terms. So all of our courses in this program are 8 weeks in length. Some terms you'll be taking 2 classes at a time. Handful of terms you'll be taking just a single course at a time. This is going to allow you to be a full-time student. It's going to allow you to finish the degree program in a 2-year time frame. Here's the breakdown of the total credits. So it's 60 total credits, but as you can see, they're not all in one bucket or one area. This does allow you to transfer in credits. So if you've attended school somewhere else, and you may have the ability to transfer in some credits and shorten that time frame. But again, these are kind of the buckets of where those courses are. So here is a sample of the program. Most likely, this is the track that most of you will follow. As I mentioned, if you did transfer in some credits, you may take 1 or 2 less courses in one of these areas or something like that. So this could look a little bit differently for you. But generally speaking, this is going to be the path that our students would take. So each one of these terms that you see is 8 weeks in length. So again, like I mentioned, majority of the terms are going to be 2 courses at a time. One area that I'll highlight is the ZTC. That stands for zero textbook costs. And as you can see, we have a decent number of those in this program. That's something we're proud of. It helps keep costs down for students, and it allows us to have a little bit more flexibility. So without having the textbook cost, and you can see how many are here. I'm going to show you the second year in a second. You'll see a couple of those again. Wherever it says alternative or alt, that means you have options. You could possibly take a different course in that area and still satisfy that requirement. So there are some courses where you may be able to take a psychology course in a different term instead of a history course in that term, if that's something you'd like to do. So there are going to be some flexibility that you can have as well. So this is the first year. Now you get into the second year, and you'll see there's two terms here where you're only taking a single course. And again, you'll see some of those alternative, and you'll see the last capstone course is a zero textbook cost course as well. So that's the program. Just go back real quick, let you kind of get an idea. I know this is one of the areas most people are wondering, hey, what would I study? How would it look? So give it a minute to sink in. Again, this is being recorded, and it'll be sent out to you within a day or so of this evening. So you'll get this on your own. You can see again some of the core classes that'll specifically be in this health sciences degree. All right, cost. So the cost is what it is. We're not shy about it. We're going to put it right out here and let you all know this. It's competitive cost. If you do any sort of research into other schools, you're probably going to spend somewhere around $25,000 to $30,000. So this is in line with those costs. What I did was I broke this down by 60 credits, which would be the total number of credits you would need. You'd be looking at about $35,000. And then I also said, well, what if you transfer in some credits and you only had to do 30 credits to complete this degree? Well, now you're talking closer to $17,000. So depending on transfer credits, you can get your costs down. We also have what's called prior learning assessment. So maybe you've been working for the last 10 or 15 years. Maybe you have some certificates that you've completed. Maybe you're a firefighter, an EMT, something like that, where you have these trainings under your belt. You can submit those to be evaluated, and we can see if any of that training material coursework could possibly satisfy some of these credits as well. So there's another opportunity that you may be able to get your credit total down, which would keep your costs down. On the right-hand side of the slide here, we have the different options that are available to you. I always like to start out talking about tuition reimbursement. I think that's the greatest benefit that most people miss out on if they choose not to go to school while they're working. But I would strongly encourage you to check with your human resource department to see, is this a benefit that you're eligible for? And then if they say yes, then you got to dig a little deeper. You got to have your other questions ready to go. Questions like, how much does it cover? Is that an annual amount? Is it by course that it caps out? Does it run fiscal year or calendar year? So understanding all of those things are really important. We'll be able to help and understand how we can take advantage of that. Again, if it runs calendar year, then that's great. We might be able to get, some of that money used up before the end of the year and then have it reset in January, and you can use it right away again. So again, things you want to research and look into. One is if you have it and you're eligible for it. Two is, what does it cover and how does that dollar amount apply? And then lastly, what is the process to utilize your tuition reimbursement? Do you have to complete the courses and then submit something after? Does it have to be pre-approved? Do you need the school to do something on our end to fill something out, like a voucher or something to help you out? So the more that you can research and understand, the better it'll be when you speak with our finance team to go over this as an option for you. So tuition reimbursement can be really good. We also have a decent military and veteran population. So I will tell you there is a military rate available. And then we do work with veteran benefits. So again, if that's something that applies to you, we'll get you in touch with one of our military advisors that can help you with all that kind of stuff. The other option that I want to cover in detail here is financial aid. The majority of our students do apply for and try to utilize some sort of financial aid. Again, a financial aid is a free application through the government. And you would apply to see what you qualify for, and then based what you qualify for is what we can apply to your program. That is a free application, the free application for federal student aid. You also might have heard it called a FAFSA. On the next slide, I'm going to give you our school code, and I'll explain a little bit more about that when I go over there. But financial aid is a package of sometimes grants and sometimes student loans and sometimes a combination of both. It all, again, depends on what you qualify for and the dollar amounts that you qualify for. And then lastly, if you're fortunate and you have money that can go towards your education, then you can choose to pay for the courses up front. Or we could put you on a payment plan and you can pay them over the 8 weeks for the given course or courses that you're taking. May help you manage it a little bit better that way. I will tell you also, we do have academic partnerships with a lot of organizations. And if you are part of one of those partnerships, you may be eligible for a tuition discount or just a flat out discounted tuition rate as well. So that may be something you want to look into if you're wondering. All right, so if you like what you hear, program looked good, cost seems reasonable, then the next step would be to begin your application. There is no application fee. So you can apply to this program tonight. It's not going to cost you anything except for a little bit of your time. You would go to this website. We only accept official transcripts. So don't try to send us unofficials. We're not going to do anything with them. But you can have your official transcripts sent to this address. Usually the evaluations, once we have the transcripts, are done within 48 to 72 hours. So pretty quick turnaround time on our end. The lengthy part of this process is getting the transcripts. So again, if this is something you're considering, I would recommend requesting your transcripts this evening, just to allow time for those to get in and get evaluated. If you were looking into the prior credit evaluation, prior learning assessment that I had talked about, you want to gather any of that information. Some of this may be housed in your HR file or with your HR department. Some of it may be certificates and programs and things that you've printed out at home. But wherever you have that, you can gather that and get that ready to be submitted and reviewed as well. When you are filling out your FAFSA, again, free application for federal student aid, it's going to ask you where you would want your school aid report sent to. You're going to have that listed, this code here, and that would notify them to send it to Excelsior University. So again, 014251. Again, this presentation is being recorded and going to be sent out to you. So if your head is swirling and you're wondering about all this stuff, this will come over to you as well. No need to frantically jot this all down. So again, the steps are pretty simple. You would go here, complete the application, get your transcripts requested, and if you're going to apply for financial aid, you'd want to go ahead and get your FAFSA application completed. The only additional next step that I would ask for this evening is for the folks that attended this presentation, email this admissions inbox here. This is going to go over to Bethina and her teammates. This would let them know that you've already attended some sort of an info session, have some idea of the program and about the school, and it'll also allow them to follow up with you a little bit quicker. So again, if you are interested, when we get done this evening, go ahead and shoot an email over to this inbox. If you'd like a phone call, include the best phone number to reach you and maybe a few times that would be best. Our team will do the best to accommodate in reaching out to you during those times. And then lastly, if there's anything that you think would be beneficial for us to know about you while we're going through this process, you can include that, whether that's your work history, prior schools you've attended, additional questions you might have, you can put those on that email so that when we follow up with you, it can be more productive. All right, as I mentioned before, the presentation is only about 20-25 minutes. So the rest of our time is for questions. We have both the chat and the Q&A feature, so you can put your questions in either one of those two areas. There are about a handful of you on the line. I will tell you there's nothing else to present tonight. So if you feel like you've got the information that you were looking for, then we are done. You can go ahead and hop off. And I do want to thank you for giving us your time this evening and finding out about this program. But if there are any questions, again, you can put them in the chat or in the Q&A. Bethina and I are going to hang for a little while to answer any of those questions. And yeah, again, thank you for the time this evening and looking into Excelsior and looking into our Associates in Science and Health Sciences program. Not seeing any questions come in yet. Nina, good question. Off the top of my head, I do not know. Bethina, I'm not sure if you see the question or not, but the question is, how long have we been accredited?
So I'm not sure in regards to like the middle states, but I know like since Excelsior's creation, they have been accredited. And that's how they've been able to like give out degrees to different people, like through the different adult learning experiences. But in regards to the middle states, I don't know the exact time frame, but we've been accredited since we've been a university, as well as when we used to be like Excelsior College, and prior to that when we were regents. So. I don't know the exact time frame, but through each of those transitions, we have been accredited across all of our programs.
Yeah, and Nina, I have your name here. I can go ahead and try and find out more concrete answer and get back to you. Good question, though. Any other questions? There's a handful still with us so far. Anything else that you're thinking? That was a good high-level question, so I appreciate that. Few people still hanging. Looks like Angel or Jermaine. Any questions from either of you? Did you find this helpful? Did you get your questions answered? And they are both gone. So that's it, Bethina. That was our only question. We had, looks like 4 or 5 people were in at different times. So that's what I said
Okay.
about expect. Go ahead and